Hey, health junkies! It's time for the Health Fix. Join your host, Dr. Janine Krause, as she gives you a dose of what you need to know and do right now to take control of your health from the inside out, to rebel against aging, look damn good, fight stress, and laugh every day.
Hello there, health junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Janine Krause, and today's episode is all about inflammation. So I say the word a lot, and we probably hear the word a lot all the time, and we're told we need to reduce it and eliminate it. But what is inflammation? And why do we really need to be paying attention to it? How does it occur? And so today I'm going to talk about what different things promote inflammation in the body, why stress can promote chronic inflammation, why veggies are absolutely key to keeping inflammation in check, also why culinary spices are huge, even maybe more so than veggies in terms of their power, but yet I do think the veggies need to be on board to help to keep that inflammation in check. And also I'm going to kind of end the podcast out with what you can do every single day to keep your inflammation in check. Because let's put it this way, inflammation is actually a natural process. We do want it to occur, and I'm going to kind of explain a recent injury that I had and how it kind of played out, just to kind of give you a sense of what's happening and what's normal and what's going beyond normal and becoming a chronic inflamed state. So to begin with inflammation, I've got to go with the 4 characteristics of inflammation, as any good anatomy and physiology instructor would do. And those 4 characteristics are redness, swelling, warmth, and pain. And just for fun little tidbits, we used to actually talk about them in terms of the Latin words that were used for them. Rubor, which is redness, turgor, which is swelling, dolor, which is pain, and calor, which is warmth. And if you speak Spanish, some of those words are very familiar to you, because especially calor and dolor, warmth and pain, those are 2 big words that we use in my practice when I'm working with folks that speak Spanish. So let's talk about inflammation, and I'm going to talk about it in terms of the most recent experience I've had with it and something that's visible, because a lot of us have digestive system inflammation and we don't know it, or we choose to ignore it in some cases, and that's a problem, and I'll talk about that. But then also a lot of us have arterial, so in our arteries, inflammation that we might not even see or feel, but it's happening and it's developing over time. And anyone who's seen their cholesterol start to go up, you might have some inflammation happening, causing that to do that. So we'll talk about that today. Now, let's start with what I saw. So about 3 weeks ago, we were doing a box jump type of workout in the gym, and I swing my arms before I jump to get on the box, and I smashed my left ring finger just kind of on the box and right at the knuckle as I was jumping up. As soon as I did it, of course, I felt dolor, so that's pain, first sign of inflammation. Then it started to swell pretty quickly. It was just a couple of seconds, and that darn knuckle was getting larger. And so what's happening in this case? Well, we're bringing a bunch of white blood cells to the area, because as soon as that initial hit takes place, the body goes, uh-oh, something happened, and it kicks out, and the cells really in the area of that knuckle start to kick out cytokines. And the cytokines are like ring the bell. They are proteins that come from T cells, part of our white blood cells in their immune system. And they're like, help, this area is injured, we need to do something, bring over the cytokines. And things such as interleukin 1, interleukin 6, interleukin 11 and interleukin 8. Those are your big main acute inflammatory cytokines, in addition to tumor necrosis factor alpha. So I'm geeking out a little bit on you, but these are common folks that are brought over. These are our cytokine proteins, and what they really do is they signal the white blood cells in the area that there's a problem. And in this case, because it's not an open wound, I'm not fighting bacteria, but what I'm doing is fixing, I'm going to have to fix the jammed joint, because I slammed the knuckle right into the box, which is a plywood box, so it's kind of hard. And so we've got these white blood cells running to the area, And we have capillaries, so our tiny little blood vessels in our skin, they're opening up and they're becoming more permeable. That's a word. Permeable. So they're opening. Oh, and my little monster, my little puppy's here with me. Say hello, Brian. He's hanging out. He can't be by himself. So I apologize for any random noises that sound like I have a dinosaur with me today. Just keeping it real with the pup. But that capillary dilating, we're getting more blood flow to that area. And so, within seconds of me smashing my knuckle on the box, my ring finger knuckle really started to enlarge. And that's like prime inflammation right there. That area is swelling. So anyone who's ever hurt themselves and say sprained an ankle, for example, that's always a good one to use as a prime example for inflammation. As soon as you stepped off the curb wrong or you're running and you rolled your ankle, as soon as you feel that happening, you pretty much feel the pain. And then after that, boom, that ankle is like swollen in seconds. And that's your body's amazing ability to get those little tiny capillaries to open up and bring in a bunch of fluid. And how do they bring in the fluid? Because all the cells in the area of where you just injured trigger the release of histamine. Now, a lot of us are familiar with histamines in terms of allergies. And yes, they're on hyper alert with allergies. Histamine is kind of one of our other warning signals in the body that something's not right. It's a neurochemical. And it's used in digestion even as a normal warning sign that there's food in our stomach. And it'll tell our body to help us to digest and release digestive enzymes. But in the case of an injury, the histamine is one of the biggest guys that keep calling over the white blood cells after those cytokines got started. So it's kind of like the cytokines initiate the warning bell, and then the cells in the area start to create the signals for releasing histamine. And in particular, mast cells are the cells that release histamine. And so now we end up with the fluid starting to really build up in that area. Now, with my knuckle, I could immediately feel the stiffness and difficulty moving that joint. Now, this is an acute injury, but imagine if this was something that happened to me every single day. A lot of us have chronic injuries in chronic inflammation or chronic pain because at one point something was acute. We acutely injured something, but then the body forgot, or I guess you could say dysregulated itself. It didn't keep the inflammation in check. And so even though there was nothing happening, we've already fixed the problem, the body kept causing trouble in that area. Now, why would a body want to do that? Well, it's because we have a lot of other factors that keep or promote inflammation. And I'm going to talk about that a little bit later. And in particular, I'm going to talk about how it relates to our environment, the frankenfoods that we eat, how stressed we are, and allergy irritants too, because a lot of us have homes that we are not aware of the amount of mold that we have in them. We also have dust mites and any rugs and things you don't clean very often, or throw blankets. Those guys are big carriers of allergy producing trouble, let's put it that way, or histamine producing trouble that can keep that inflammation going. And so I'm going to talk about that a little bit later. So let's jump into my finger again. So after I hit it, cytokines were released, the white blood cells came over, the histamines really were released on full alert, and now we had swelling in that joint. It was hot, it was red, it was swollen literally within minutes of the hit. That's pretty impressive how quick your body can jump on it and work to fix something. Now, one of the things in this case a lot of people do is put ice on the inflamed area. And that's good because it is going to minimize the swelling and it'll keep things from not getting too big. The problem I had this particular day is that I had to work. And I work with my hands a lot because of acupuncture and cupping and gua sha and all the things that I do. And I didn't have time to properly elevate my hand and to drain that fluid. So that's part of that RICE, if you're familiar, the rest, ice, compression, elevation. And that's what you should do after an acute injury, just to kind of minimize the amount of inflammation that's created in that area. Unfortunately, I couldn't do that. I had to jump into work. So I watched my lovely knuckle get bigger and bigger as the day went on. Now, the beauty of my job, I had something called Dr. Bob's Medicated Oil, which, by the way, they do sell it on Amazon. It's magical stuff. It has peppermint and cinnamon and licorice root in it. And it's great for moving blood, so keeping that fluid moving around that injured area. And I often use it for acute injuries in my office, or even some chronic injuries too. I like how it smells. It's just something amazing. So I had that on, and so things got pretty swollen and bruised for the rest of the day, but thank goodness it was on my left hand, so I could keep things going. So now I've just described to you the acute phase of how things go. I had redness, I had heat, I had swelling, I had bruising by about 6 hours after it. And then the next day, it was gone. The bruising was gone. Now, I still have the swelling 3 weeks later at this point. I've been working on making sure that I keep that joint mobile, because that's the one thing that a lot of us will struggle with, is if we roll an ankle or sprain an ankle or, knee or something of that nature, and we have the swelling, a lot of times we stop moving. That's the worst dang thing you could possibly do in the case of acute injury. You got to keep it moving, because it's going to help to keep that blood flow going and cycling in and out of the inflammatory proteins. Now, another thing I did when I got home that day is I started to use heat and cold. So 3 minutes hot, 30 seconds cold to the area. What that does is it radiator flushes that inflammation. And so by that, I am provoking movement of fluid so inflammatory fluid to the knuckle to help to heal it, right? And then with the cold, I'm flushing it away. So I'm bringing in, flush it out. So bring in new stuff, flush out the old stuff, bring in new stuff, flush out the old stuff. And it works really well to help with speeding up the healing process. So if you ever get yourself into some trouble with an acute little injury, do the rest ice compression elevation. And after the first day, after the first 24 hours, then I start to jump right into the hot and cold, alternating therapy. Now, like I said before, I really should have put the cold on it, the rest ice compression, as soon as I did it, but I didn't have time. So keep that in mind that I couldn't, and hopefully you will be able to do that to help keep things a little bit more in check. I don't believe that by not doing it, I really hurt myself, it did myself too much harm, but I do think it's important, especially if it's a bigger joint. My finger is minimal compared to ankles and knees, but it's important to keep in mind. All right, so moving forward. Now, after the swelling happens in the acute, first 24 hours, we also have some blood clots that are going to be forming, and that's going to help to fix those broken capillaries. And those broken capillaries are what are going to cause bruising. That's how we get bruises. It's tiny little broken capillaries. And as they get fixed, that's happening within the first, 24 hours. We're starting to fix those guys. And our white blood cells are going to keep working hard. Now, if you had open skin and maybe a bacteria or virus or fungus could have got in there, then those white blood cells are going to work hard to kill that. If you didn't have open skin, and I didn't break the skin in this case, those white blood cells are going to gobble up the damaged cells, and they're going to help to remove them from that area. And that's where that alternating hot and cold after the first 24 hours comes in handy, because it's nice to have new inflammatory proteins in there to help and, just keep the fight going and keep the remodeling of the tissue going. But it also is nice to flush them out and kind of go back and forth. So if you have any pus that forms in that acute phase there, that's your white blood cells getting rid of debris. Any dead bacteria, virus, or fungus, or even dead cell tissue. So pus is not a bad thing. It's just the body clearing the junk. If it becomes green and the area becomes really hot and swollen after the initial injury, so after 24 hours, now you're looking at maybe an infection. So something to keep in mind. So let's talk about this a little bit more in terms of phases, because I think at this point I've been a little all over the place with my finger, but acute inflammation really should last about 72 hours. After those first 72 hours, then you head into what's known as repair phase. And that's where you're really working to fix whatever was damaged in that blow. So in my case, I am guessing that I probably jammed my joint pretty good. I'm guessing that possibly my tendons or ligaments had a little bit of strain just in terms of how the injury went down. And so I'm going to be guessing that I probably will have some pain and irritation in this knuckle for about 6 weeks. And I am currently in the repair phase. Now, after those 6 weeks, you're going to be going into what's known as the remodeling phase. And that's really where the body's improving the quality and the orientation of the tissue that it's fixed. And so it's working on the strength of the tendons and ligaments. And so that's crazy that this stuff can go on, but remodeling phase really can last 6 weeks to 12 months. And in some research cases, folks will say up to 2 years. So I guess it depends on how bad you injured the area. I'm pretty sure I'm not going to be looking at this joint having trouble in 2 years, but that's the key here. I see people with pain all the time, and we have little minimal injuries that turn into chronic issues that shouldn't. And that's the biggie. And so in the repair phase, this is the key component of keeping the rest of your body super healthy to keep this from going into a chronic inflammatory state. You want to have enough vitamin C. So that's your dark leafy greens. That's your oranges, kiwis, all that good stuff. Because vitamin C is your precursor to collagen formation. You need some vitamin C. You also need oxygen to those tissues. And how do you get oxygen to those tissues? You need to make sure that you're eating really good and healthy foods that have some iron in it so that your body can bring oxygen to those tissues. So anyone who's vegan or vegetarian, this is something to keep in mind, that you need to make sure you're getting in your iron-rich foods like spinach and your dark leafy greens and your raisins and your oats, blackstrap molasses even. So those types of things. Beets, also another big iron-rich food. I love eating beets when I'm trying to work on an injury because beets help with something called nitric oxide. It helps dilate vessels and get blood flow to where it needs to be. So beets, vitamin C, and really working on things such as collagen peptides in your diet, adding those powders in. Buckwheat seeds and leaf. There's a product called Saruda by Standard Process. Absolutely love that for helping with tissue repair. Standard Process has something called Ligaplex 1 and 2. Those are also great for tissue repair as well. I like collagen peptides and buckwheat. That's just how I do it, but hey, you can do it any way. Now keep in mind, Standard Process is not paying me for this. I'm just saying it because it's something that I use in my office. Alrighty, so eating well, moving that joint, getting in the ice in the first acute 24 hours, then working on alternation of hot and cold to keep that inflammation in check so that it doesn't go to chronic. Now, it's also ways to think about this is what are you doing, overall in your life with your diet? And this is, I think, where I want to switch from talking about acute to the chronic inflammation. So interleukin-1 and tumor necrosis factor. These guys are the two big cytokines. So remember those, these are inflammatory proteins that cause inflammation in the body. And if we have an injury, in the Chinese medicine world, I think is the best way to describe this. If we have an injury, the Chinese basically believe that your body's going to remember every single place that's ever injured itself. And that's going to become a weak area for you. And weak, not meaning by strength or anything of that nature, meaning like if your body is going to go on hyperinflammation alert, those old injuries are going to show back up. And so it's important to keep that chronic inflammation in check. So in chronic inflammation, the body keeps releasing those protein cytokines and sending messages to the brain, telling it to bring more white blood cells to that inflamed area. So those white blood cells think there's an internal threat, right? And so does the brain. And so the body keeps sending all the materials, so all the troops it needs to put out the fire, right? To get rid of the inflammation. But those white blood cells, they're eager to attack. They want to do something. And when they're bored, they start to attack your own cells. And that's where we start to have issues with autoimmune conditions. Now, the other problem that could be happening is there could be a real threat and we can't feel it, such as blood vessel inflammation and plaquing. The higher your blood sugar goes, even if you're not diabetic, the more that you have spikes of your blood sugar, the glucose not being able to get into your cells, that glucose will scrape the inside of your vessels. When it scrapes the inside of vessels, your body's calling white blood cells there to fix that. But at the same time, it's making it really easy for cholesterol plaques to get into that artery and clog your arteries. And so this is how we end up with cholesterol, plaquing issues, and blocked arteries. Now, the other biggie is gut inflammation. I've mentioned that probably a million times in all my different podcasts. Oh, this is Brian. This is my baby saying hello. Yes, hello. So he apparently has some gut inflammation he wants to talk about. Did you want to talk about your gut inflammation, Bri? Yeah, okay. So anyway, the gut, all the crappy food, all of that stuff, if you keep having gut inflammation, your digestive system lining is going to become leaky. You're going to get food molecules into the bloodstream that your body doesn't know what to do with. Now add that to having the elevated blood sugar causing trouble in your arteries, and you've got double trouble. And that's also why our arteries going into our joints, they narrow a little bit. And oftentimes, if you've already got an inflammatory process because of food going on, you also could make it worse, unfortunately, by having all those food molecules and then having blood sugar elevated, and boom, trouble. Now, I'm not here to scare you or anything. The most important thing is just to me to help keep you, abreast of what could be happening in your body. Now, let's talk about tendon and ligament overuse. Now, a lot of folks do repetitive exercise types of things or repetitive jobs. If you've injured one of those tendons or ligaments and you didn't give proper rest time and you didn't learn how to strengthen the weak muscles that, unfortunately, you've got your strong muscles and you've got your weak muscles, and your strong muscles are the ones that are going to have the tendons that get inflamed. And those weak little muscles, your stabilizer muscles, are the ones you need to work on so that those big muscles don't have to work as hard and less tendon or ligament overuse issues. So point being here is making sure that you're looking at your posture, your mobility, and making sure that your little muscles work just as well as your big ones. And that'll help you to prevent the tendon and ligament overuse issues and chronic pain in that case. Now, interestingly enough, the tumor necrosis factor, that's that other cytokine involved in chronic pain, research has shown that it actually can cause a lot of white blood cells to specifically attack nerves. And I think that's why we're ending up with a lot of nerve issues in folks. So neuroimmune, chronically inflamed nerves that are now being attacked by your body. So autoimmune attack on the nerves, or if you will, a neuroautoimmune condition. And I think that is a lot of the case with a lot of folks who have chronic pain. Maybe the inflammation starts in the gut. Maybe it starts with stress and the body not being able to control the inflammatory response. And of course, in other podcasts, I've talked about the vagus nerve and how it's involved in chronic stress. But I definitely want to go into detail a little bit again here, just so that it keeps making sense to you, so that if nothing else, I can encourage folks to really work on their stress, because this is another factor. Chronic pain and stress go back and forth. The pain stresses you out, and it's just back and forth all the time. So let's get into how that stress causes chronic pain. All right, so that vagus nerve again comes into play when we're talking about chronic inflammation in the body. And the reason the vagus nerve comes into play is because it is the nerve that senses danger in our body. It's our longest cranial nerve. It's our cranial nerve 10, and it's one of our primal nerves. And so its main job is to tell our brain danger, not danger. And so if it senses that there's anything irritated or there's something wrong, even if there's a damage to a nerve, we're going to get a message going up to the brain saying something's not right. And the message back down is going to be that we've got to bring white blood cells to the area. We've got to bring blood, enhanced blood flow to the area. We've got to figure this out. We got to heal this up. Now, the vagus nerve has the ability to shut off the inflammatory response. But when it keeps getting pressed in terms of something's wrong, and all these red lights are going off all over the body. It gets overloaded and it can't regulate inflammation. And so the process falls apart. And oftentimes what we see in this case are things like fibromyalgia, chronic pain issues in certain areas like back pain, etc., that just won't quit. Injured nerves, so injured peripheral nerves, so our nerves that are out in our periphery, not in our core, but the ones that are in charge of contracting muscles, the ones that are in charge of sensing pressure, so our cutaneous types of nerves, so pressure and touch, the nerves that are helping us to tell where we are in space, those nerves will make a cytokine. So remember, cytokines are proteins, known as IL-6 in particular. Now, one of the things I've talked about before when I talked about restrictions and need for mobility of our joints, well, the reason our nerves will send out pain signals often is because they don't know how to sense where we are in space. Now, that might sound weird to you, but our nerves in our joints and around our joints and in our tendons and ligaments and in our muscles are always kind of there, just seeing where we are in space, what we need to do to adjust to our environment. So like, for example, you're walking on a beach, there's a slight incline. You're walking up a hill, there's a slight incline. You adjust to that naturally, and you don't even have to really think about it. Well, unless it's like a huge hill. Now you might think about it. But your body's constantly helping you with dealing with uneven surfaces, things of that nature. But if one of those nerves that can't tell where you are in space, they're known as proprioceptive nerves, well, what ends up happening is over time, they can become injured. And by that, I mean they're not sensing like they should. And that also can elicit an increased release of cytokines in a particular area. This is why I'm huge on telling folks you got to get up, you got to move, you got to stay mobile, because this could be a big, big issue. Now, there are even these protein cytokines that can tell white blood cells to keep moving to an area of inflammation and increase the pain more. And this is a big deal as to why we have such pain issues in our society. One, our frankenfood, number one, and the lack of movement. These two issues are quite possibly why we're staying more and more inflamed longer. And something that really is important to keep in mind, that we have nerves in our body that actually can inflame us. And that's why a lot of times we have been working on trying to reduce someone's pain and struggle with it. Because if someone's not working on their own mobility and their body's ability to sense where it is in space, in addition to eating healthy, it's going to be really hard to get rid of their pain. There needs to be some steps that work in that realm to help folks. So something to think about. Now, these cytokines are tricky. We even have one that's called interleukin 10 that normally it's coined as an anti-inflammatory cytokine, but Epstein-Barr virus can actually make a protein itself like this anti-inflammatory cytokine, and that's how it gets into our bodies easier and into our immune system. And that's why I believe that a lot of people have Epstein-Barr virus, otherwise known as monovirus or the kissing virus, that we contract usually in our late teens, early 20s, when we're pushing it to the limits, studying and staying up late and having fun, and our immune system becomes downregulated. And unfortunately, it seems that a lot of people have Epstein-Barr virus that's sitting around hanging out in their necks and just waiting to cause trouble and fatigue and extreme pain and issues with the neck and issues with dizziness and ears popping and thyroid stuff. It's crazy. But just one example of how a virus can even mimic our cytokine protein signaling. It's nuts. So I digressed a little bit there. Let's jump into conditions specifically related to cytokine overproduction. So I've alluded to diabetes being one of the main issues. And in particular, it doesn't have to be diabetes. It could be insulin insensitivity. It can be pre-diabetes, if you will. It can be having really high spiked carbs and drops in that. So eating too many refined carbs, being too stressed, because stress and the release of cortisol provokes glucose release, sugar release into our bloodstream. The more sugar that's released in your bloodstream that doesn't get in your cells for energy, the more that sugar rips up the sides of your arteries. And when it rips up the sides of the vessels, we end up getting plaque into those sides of the arteries really easy, and then we end up clogging the arteries. Over time, of course, it doesn't happen overnight, and unfortunately you can't feel it, but it's something that is really important to be aware of, and how this is one of the most prevalent conditions, I would say, related directly to inflamed bodies. And usually because we're eating too many refined carbs, or we end up with gut issues, we end up with too much stress, and we're not able to control our blood sugar. And so that's why diabetes and cardiovascular disease go together. Now, lungs. Easy for fluid to accumulate in the lungs when we have extra cytokines bringing in white blood cells to fight infection. So oftentimes what I'll see with folks is we'll have a bronchitis or something of that nature that just doesn't seem to go away, and then their ability to breathe declines from there, and it kind of just goes downhill into a condition of reactive eczema, exercise-induced eczema. Exercise-induced asthma, not eczema. Eczema is a skin condition that does end up going along with folks that have lung issues, but that's a whole nother story for another podcast. But it's very interesting that stress can cause breathing issues too. And so I can't help but think that wherever your weak spot is, your body kind of knows that. And that's the area when you get stressed that ends up having inflammation. I see it over and over again, folks who have had pneumonia before. It seems that when they get sick, it goes to their lungs. Folks that have had or have thyroid conditions, seems that when they get sick, they often end up with throat issues. So it's just something interesting to kind of keep in mind. Chinese medicine actually looks at the lung as being coined the container of grief. And so I'll often see a lot of folks who are struggling with stress and coping with something in their life. Maybe they haven't coped with it, they're trying to cope with it, or it's some type of situation that's caused them immense grief or frustration. And I keep seeing, oddly enough, that these folks who have stress will with unresolved issues will end up with lung issues. It kind of goes hand in hand. Asthma oftentimes has an underlying cause of not dealing with certain stressors. So something to think about. Plus, of course, going back to that vagus nerve. Vagus nerve is in charge of the diaphragm and our ability to breathe. So there you have it. Allergies in particular can set us up for lung issues. So can leaky gut. We're a barrel of what we can tolerate. And when we get to the point where we have had too many allergens going into the system or too many irritants into the system, our immune system just freaks out. It can't handle it anymore. And we start to have more serious issues such as asthma, such as eczema, different types of skin itching conditions. Oftentimes that's what I will see in my office when someone has ignored their body's inflammation warning signs for too long. All right. Another interesting one that I see quite often is bone density issues. And a lot of folks, as we get older, we do have a decrease in our bone density due to bone loss. But the more these cytokines are floating around in our system because we're eating crappy food, we're not moving properly, we're not taking care of ourselves, we end up with bone loss and inhibition of bone growth and remodeling for that matter. And so we can't replace old bones effectively. I actually saw a patient in my office who is in her 30s who's had multiple broken bones, and she didn't even know that she broke her bones. Multiple little stress fractures, and this is an autoimmune inflammation in the bones. This is a big deal. We've related depression to excess cytokines in the brain. Cancer. This is tricky because our cytokines are there to tell us that there's something bad going on and a warning sign. But cytokines, keep in mind, call nutrients over to fix and heal tissue, and they bring oxygen over as well. Unfortunately, tumors will use our body's inflammation process to help promote tumor growth. And so that's why you'll often hear a lot about cytokines when you're thinking about cancer therapies, because they'll say we need to shut down all inflammation. Well, yes, we want to shut it down so that we don't have the process going on unnecessarily. But keep in mind, like I said before, inflammation is good when you have an acute injury. It's just when it lasts longer than it should, it's not good anymore. And in some cases, depending on how bad you've hurt yourself, like I said earlier in the podcast, 12 months and in some cases up to 2 years, there should be some inflammation depending on the extent of your injury. But for a lot of people, the injuries are minimal and this stuff should be gone by 6 months. It shouldn't be hanging around for years. So if you've had any chronic pain for more than a year, I would say it's time to really think about what you're eating and how to get the inflammation in check. And because most of my practice is a pain-based management practice, I see a lot of folks turn around amazingly if we work on their diet, we work on their stress, and we work on mobility. It's incredible. So what is one to do to get rid of overactive inflammation in the body and put your inflammation in check so that it only is kicked in when you have an acute injury? Well, first things first, you got to have some good fats in the body. Walnuts and regular nuts, not roasted. So I'm talking about raw nuts, sprouted nuts. You can toast them at home, but you do not want them roasted. That makes them rancid. Olive oil, expeller pressed olive oil. Cold water fish and avocados are great ways to keep inflammation in check. And I recommend choosing from this list and trying to incorporate it into every single meal, something from this list, or at least a snack for that matter. Walnuts at 1 ounce a day, olive oil, a tablespoon per meal, cold water fish, about 3 to 4 ounces, avocados. I kind of am really a big fan of at least a half of avocado a day to keep the inflammation at bay. All right, spices, ginger, turmeric, rosemary, oregano, cloves, nutmeg, cayenne, all amazing spices to be adding into your food every single day. And usually I'm telling folks like about a tablespoon or so, at least 2 tablespoons of mix or match of these guys into meals. Sounds kind of crazy, like a high amount, but boy, if you mix or match this and get that in, oh gosh, it can make a world of difference for you. Green tea. Lots of great tannins in there. I love drinking my green tea, at least 2 to 3 cups a day. Oolong is a great type of green tea. Sulforaphane. This is a extract from the Brassica family. So this is the cabbage, cauliflower, Brussels sprouts family. And this extract really is amazing at preventing and reversing blood vessel damage. It also inhibits inflammation, causing the inflammation that causes joint damage. And so this is good. You want to consider getting in some of the cabbage, cauliflower, broccoli family, at least 1 to 2 cups a day. Onions, nettles, okra. These guys have quercetin. This helps to stop the histamine reaction in the body. So if you have itchy, scratchy, you have redness, commonly inflamed joints maybe, or anywhere else in the body, skin stuff, quercetin is amazing. 5 spears of asparagus, capers, a tablespoon of those guys. These can all work at lowering the amounts of histamines in the body. And if you have allergies, like seasonal allergies or mold allergies or animal allergies, I do recommend adding in quercetin on a daily basis. So those guys are amazing to help with that. Dark leafy greens, always a huge fan of those guys, at least a cup a day to help with getting vitamin C, vitamin A, but also helping to reduce inflammation in the body. Then there's berries, cherries, elderberries, goji berries. These guys are amazing for helping to reduce inflammation too. Anything that's like red or purple in color, half a cup a day of those. A plum, dark purple color, great way to reduce inflammation. Apples, who would have known? The skin of apples in particular is amazing with its great amount of fiber. And then there's whole grains. And whole grains get a bad rap, but brown rice, quinoa, and even bulgur wheat, yes, I said it, wheat, can help with inflammation in the body because of the fiber component. Now, if you sense that you're sensitive to wheat, I would say going to brown rice and quinoa as your main grains and starting with those and see how you do. Now, if you're wondering, do I have this list somewhere? Yes, it is in my podcast notes at drjkrausend.com. So head over to my website and look at my podcast notes and you will have all of those right there. Now, I also have a list of my favorite anti-inflammatory herbs. Some are Chinese-based, some are Western herbs. They're kind of a combination, and I've noted what they've been found to be particularly helpful for. And these I found in my practice, but also found with research in terms of what they are useful for. So I'm talking about things like devil's claw, cat's claw, boswellia, that's frankincense, willow bark, turmeric, also andrographis, berberines, Oregon grapefruit, and golden seal are really great. Romania, which is Chinese foxglove, Polygonum motiforum, which is a type of herb that's really great for protecting the blood vessels to the brain. Artemisinin, that is coming from wormwood. Great stuff here. So take a look at my list at drjkrausend.com for more information, just to give yourself a little sense of what's out there and what kind of herbs can be extremely helpful for you in addition to food to help you keep that inflammation in check. Now, I am a huge fan of 6 to 8 cups of veggies a day. I see huge changes with patients when they increase their veggies. So my recommendation, if you're not into all the herbs, in which, I'm not here to try to sell the herbs to you, and it is tricky when you don't have a doc monitoring what you're doing. There are great formulas out there, such as Turmeric Forte, Turmeric Supreme by Gaia Herbs. These are great products, but I do recommend, if you're going to play with herbs, you definitely want a naturopathic doctor, a functional medicine doctor to guide you in that department. But food's easy, and I see some really great changes with food. 6 to 8 cups of veggies a day, getting in your good spices that I mentioned, like oregano, turmeric, rosemary, those guys, ginger. Really amazing stuff for the body, and you got to eat anyway, so might as well get foods in that are going to be beneficial for you to keep the inflammation in check. So food number 1, eating closest to nature. Number 2, mobility. Start moving more. Don't be such a couch potato. Get up from your desk at work. Work's always going to be there. You want to not have pain for the rest of your life, so get up and move. And then stress management. Another biggie, because keep in mind, your vagus nerve has a lot to do with how you manage stress, and it remembers all the traumas you've been through in your life. You might think things are insignificant compared to other people's traumas, but you know what? They're your traumas. And every little thing that's happened to you, that's stressed you out, that's caused you, as I call it, brain damage over time, your vagus nerve remembers that. And the less trauma you can cause for that poor nerve, and the more you can help it to regulate by breathing, by going out and having fun, by moving, by just taking some of the load off your plate and channeling your inner 5-year-old and finding fun in life and having fun in life. That's how you do it. And I highly recommend going for those first before you start to play with the herbs. But all of that information is over on my website in my podcast notes, episode 76 here, and it's drjkrausend.com. All right, everybody, you have survived another episode of The Health Fix. I'm your host, Dr. Janine Krause. Thanks for listening. Thanks for tuning in to The Health Fix, the podcast all about taking control of your health, rebelling against aging, and having fun every day. A lot of patients ask me, do you think I'm aging too fast? So, I created an evaluation checklist for you to see for yourself. Plus, I created a resource guide to help you slow down the aging process right now. You can find it for free on my website, drjkrausend.com. If you like this podcast, help get the word out to others by liking it and rating it. If you'd like more natural health tips and want to join our Facebook community where I interact daily, click on the Join Group button on our website at drjkrausend.com.